Okay, so if I ask you, what do you think is currently wrong with the way that this psychiatry is practiced?
Yeah, I think it's really simple. I mean, our model is just symptomatic based treatment, right? And no other medical specialty just treats patients with symptoms. If you have chest pain, their doctors are going to do a workup. Is it, a heart attack or is it a panic attack? Very different treatment. If you have knee pain or headache or any other symptom, we're going to look at underlying physiology and do tests. In psychiatry, we have no testing. We just have these list of symptoms. So our patients come to the doctor, and if they're sad, they get a diagnosis of depression. Nobody's looking at hormones and vitamins or minerals or anything.
Hello, everyone. Today, I have the privilege of sitting down with one of the fathers of modern functional psychiatry, Dr. James Greenblatt. He's a dual board certified psychiatrist and a pioneer in functional and integrative psychiatry with more than 3 decades of clinical experience. He is the founder of Psychiatry Redefined and has dedicated much of his career to looking beyond psychiatric diagnosis and symptoms to understand the nutritional, metabolic, and the biological factors that may be driving mental illness. He is also the author of several important books in the field, including Finally Hopeful, which I have here with me, and Lithium Revolution, and also Functional Medicine for Antidepressant Withdrawal. Dr. Greenblatt, it's truly an honor to have you with us today. Thank you for joining us.
My pleasure. Glad we could have a chance to talk and kind of spread the word about how we can improve mental health outcomes.
Thank you very much. To move to my first question, you have been practicing psychiatry for more than 3 decades. I want to take you back to the beginning. You were trained within the conventional psychiatry model. So when did you first start realizing that the conventional model wasn't giving you the answers you needed for your patients?
Sure. I actually went to medical school and, interested in nutrition and health. And so that's why I went to medical school, and that was my interest. And then I did conventional training and 9 years to be a child psychiatrist. And I just slowly evolved, with the model of care that we have, which is medications. And then a few years into private practice, I realized that medications weren't the answer. They were just symptoms, lots of side effects. And I remembered, why I went to medical school and started, pursuing the functional medicine. That's 30 years ago when that started becoming popular in the States, and was able to, focus my academic and career on eating disorders. And so that enabled me to continue to talk and research about nutrition and brain function.
Okay, so if I ask you, what do you think is currently wrong with the way that this psychiatry is practiced?
Yeah, I think it's really simple. I mean, our model is just symptomatic based treatment, right? And no other medical specialty just treats patients with symptoms. If you have chest pain, their doctors are going to do a workup. Is it, a heart attack or is it a panic attack? Very different treatment. If you have knee pain or headache or any other symptom, we're going to look at underlying physiology and do tests. In psychiatry, we have no testing. We just have these list of symptoms. So our patients come to the doctor, and if they're sad, they get a diagnosis of depression. Nobody's looking at hormones and vitamins or minerals or anything. So I think to summarize, what I think is the problem with our conventional model in psychiatry and mental health treatment is it's purely based on symptomatic based care. And that's okay sometimes, but it's not sufficient.
Mm-hmm. I love when you mentioned that psychiatrists forgot in the anatomy class that there is something called the neck that connects the brain to the rest of the body. It's really funny that we think about when we think about mental illness, we don't think at all about what is happening in our body.
Just to follow up on that, when we're in training, we actually learn that, low thyroid can cause depression, or anemia can cause depression, and infections. So, I mean, these are all things that we learn, but as soon as we get into clinical practice, we just don't think about it.
Yes. So before we go any deeper, I want to clarify the language, because we have several terms today. Like we say functional psychiatry, integrative psychiatry, holistic psychiatry, metabolic psychiatry. So how do you personally define functional psychiatry, and what makes this approach different from the other approaches?
Sure. I mean, for years, I used to use the term integrative and functional medicine for mental health. But the last couple of years, I just feel functional psychiatry as an umbrella term really defines what we're trying to do and educate patients and doctors. So integrative medicine, looks at lifestyle and mindfulness and diet and exercise and sleep, all the things that we know are good for us that we try to, integrate into our treatment model. Functional medicine kind of digs deeper and looks at root cause. So functional psychiatry is simply understanding if there might be nutrition, metabolic, or genetic vulnerabilities, root cause, that are contributing or sometimes causing the psychiatric disorders.
Mm-hmm. There's a very important question about if we will start to talk about the topic of depression. Last week, I had the honor of speaking with Professor Joanna Moncrief and her 2022 paper about the chemical imbalance and the serotonin theory. She highlighted the fact that there is no that much evidence that depression is caused by a low serotonin or by a chemical imbalance in the brain. So do you actually think that depression is one biological disorder at all, or is what we call depression more like a final common syndrome that can arise from many completely different biological and psychological pathways? So I want to know, how do you think about depression? How do you think about its causes? If it's not merely a chemical imbalance, how do we think about it?
Yeah, no, exactly. And I think that's the core, most important point of functional medicine and functional psychiatry is that everyone's different. So, I always use the example, if you had 10 patients, all 30-year-old, all males who are depressed, there might be many different contributing factors. Genetics are really important. One person could have, low thyroid. The next one might have low testosterone. The next patient might have low B12, a genetic variation in folate metabolism. So the list is very long, and you just can't guess. You really have to do the testing to understand. I do think eventually there is a chemical imbalance. It could be, inflammation. It could be neurotransmitters. So, I mean, all roads lead to even stress, to, chemical disruption in the body, not just the brain. But we look deeper and can find the cause, then we have a path to treatment. And we're not just guessing which medicine might or might not help.
Mm-hmm. So how when someone comes to your clinic and he has depression, for example, if I am a depressed patient and I enter your clinic and I already tried 1 and 2 and 3 different medications and I am treatment resistant, how do you deal typically with such a case?
Yeah, I mean, I think at this point, particularly for those that have failed medications, I would need to share with them before they walked into the office that my approach or model would be to do a large battery of testing, objective tests. So I'd want to look at levels of micronutrients. I want to look at hormones. I want to look at these essential amino acids and fatty acids and lipids. I want to understand what's going on. And often the most important test for those that have failed multiple medications might be a genetic test, looking at genetic vulnerabilities to depression.
So if you only have the option of ordering only 5 5 lab tests. What would be your choice? What will be those 5 lab tests that you regularly investigate?
You know, it's funny. I've been asked that question a lot over the past couple of
I
weeks.
know
You know,
that 5 is only a small number, but like if top 10, for
sure.
example, so
Well, I mean, I think we could dramatically change mental health outcomes across the globe with understanding these 5. And vitamin D is probably the most important. You know, vitamin D levels should be checked on every patient with a psychiatric illness or symptom, and then repleted. And it doesn't matter how much sun someone gets or what's in their diet. There are many, many genetic variations on how we metabolize vitamin D. So vitamin D, number 1, vitamin B12, number 2, ferritin and iron, number 3, hypothyroidism, you know, number 4. And then I think something that I don't always say in my top 5, but I think I'll say it today is because it's so common, is ruling out celiac disease. You know, celiac disease is a autoimmune disorder that affects the intestine, and you get this poor absorption of every micronutrient. And we know half the people coming who have celiac disease don't have GI symptoms. They're presenting with depression, anxiety, and they're getting missed. So in my training program and my practice, you know, celiac disease is one of those screening lab tests. And we have doctors just presenting cases all the time of dramatically changing mental health symptoms, particularly anxiety and depression. We have a few cases of even psychosis by eliminating gluten for those with celiac disease.
Great answer. I love that list. So our next question here is it's actually about the evidence for functional psychiatry, because like in science in general we are always talking about randomized control trials and what are the level of the evidence we have for a certain intervention. So when we are talking about correcting all of these lab abnormalities and some other things that we will also talk about, what evidence do we actually have that when we give someone with low vitamin D that his symptoms will improve, or B12, or for all of these things? What are the level of evidence do we have here?
Sure. I mean, I think for the 5 that I mentioned, there's academic research and many of it done within the last couple of years. There are other markers that we look at in functional psychiatry where we don't have the large body of research, but it's pretty common sense. I mean, people aren't going to spend money doing a study on iron deficiency and depression because there's no kind of return.
Incentive.
There's no one who's going to invest in that research. But let's just take vitamin D for a minute. Well, vitamin D research, we have extensive, probably hundreds, very well done research articles across the globe that is demonstrating low levels in the blood is associated with depression, anxiety, dementia, suicide risk. Okay. And a recent publication, I think it was a European Psychiatry Journal, showed that low vitamin D in pregnancy, a meta-analysis, higher rates of autism spectrum disorder and ADHD in the children. Now, the vitamin D research mostly shows low levels associated with, you know, increased suicide ideation and suicide risk. We don't have a lot of studies where people have kind of repleted the vitamin D and then followed the symptoms. So there's not a lot of interest in these kind of clinical trials. If it's not a drug, there's really nobody to support it. But it's overwhelming evidence that low levels are associated with risk. And again, I've been doing this 35 years with a group of clinicians around the world. And we know as we replete levels, patients feel better. These are simple, safe, and very economical interventions with no side effects.
Could you tell us one or two stories, if you have some stories of your patients in your mind right now that correcting something that seems trivial like vitamin D did a miraculous healing for them. If you have in mind one or two famous stories that you would love to share with us.
Sure. I mean, I have an interesting vitamin D one because it's one of the few patients where I only used one supplement. So this was a 17-year-old girl at a boarding school here in Massachusetts. And she, I was consulting at the school and they called me. She was depressed, anxious, and she started not sleeping and she was up all night cleaning. So we would call it hypomania because her mother was bipolar. And her mother lived in another state. And at the time we wanted to, give her medication, but the mother refused medications. So we did, blood work and we had a vitamin D level, I think it was 7, and which is very low. The values here in the States are, we like people over 40. So she had a 7. And while we were deciding what to do, because we couldn't use medications, the only supplement that I used, the only treatment other than therapy, was vitamin D. And this woman's completely resolved her depression, her anxiety, her sleeplessness, and was able to get back at school.
Wow.
So that is interesting because usually I'm giving multiple supplements. But another case would be the celiac that I mentioned. Someone who went off to college, did fine in high school, never had problems, and started developing, attention problems, couldn't focus, couldn't concentrate. And they went to the school doctor, and the doctor said, well, you have ADHD, and they gave them stimulants, right? So they gave them amphetamines for concentration, and that made them very hyped up. And then they gave them Xanax to calm them down. And when they came back to Boston, where I am, the parents brought them in, and we did our screening test. And this young man, that 20-year-old man, had celiac disease. And once we treated the celiac disease, he didn't have attention problems anymore. So we got rid of the ADHD diagnosis, got rid of the amphetamines, and he's a very high functioning, young adult who doesn't need medication. He didn't need medicine when he was younger, and you rarely just develop ADHD in college. But people completely missed that there were other factors contributing to his attention problems.
I want to switch gear a little bit here and start talking about metabolic psychiatry. You already have Dr. George Yaid as one of the faculty members at Psychiatry Redefined. We are now seeing a growing body of research on ketogenic metabolic therapies in serious mental illnesses. We have seen patients with bipolar disorder and schizophrenia experience very substantial improvements with ketogenic therapies and even complete clinical remission. So what are your thoughts about what we are seeing? How significant do you think ketogenic service could become within the field of psychiatry?
Well, it's a very important question. And, I've been speaking of metabolic psychiatry and ketogenic diets maybe for 10 years, before the craze and the renewed interest in research. So it's been an important part of my practice and teaching. We had conferences, I think 6 years ago. So I think the ketogenic diet is an important tool in a clinician's toolbox. But one of the things that I have found that I think is getting missed in the ketogenic community is it's not always the ketosis that is the benefit. Think about the foods that are removed in a ketogenic diet, okay? I just shared stories about celiac disease and gluten, and a ketogenic diet, it eliminates gluten and ultra-processed foods, the sugars, and that by itself has huge benefits for, metabolic syndrome as well as mental health. So in my practice now, I'm seeing a lot of patients who've tried ketogenic diets and didn't get better. And then, we dig deeper and we find out why some of these nutritional deficiencies that aren't addressed. So I think the research is incredibly exciting, and understanding, metabolic psychiatry is going to revolutionize our treatment and certainly help those with chronic mental illness, who are dying of cardiovascular disease and diabetes because no one's thinking about diet. I just think it's really important that we look at what's being removed from the diet, and that is what often is the most helpful.
Yeah, exactly. And I believe also that the ketosis in itself also we know from the literature on epilepsy that ketosis was able to make these children quit their medications and taper off these medications. And I really love the research of Dr. Ian Campbell. He showed that in one of his studies on bipolar patients that ketosis was able to lower brain glutamate levels up to 12% in his research. And something like lamotrigine that we give for bipolar patients is like only 6 or 7% on average. So I think that ketosis by itself has some therapeutic effect.
No, absolutely. It's tremendous benefit. I think the challenge is compliance and being able to sustain it. But I think the research is quite clear across major psychiatric and neurological disorders where they looked, as you said, Dr. Campbell did, at ketosis, the implications from insulin to neurotransmitters, are profound and has significant changes in the brain that we know can make major differences.
Yes, exactly, and also I want to start talking about the concept of inflammation and neuroinflammation. Because it's one of the I think the most famous and most important root causes of many different mental illnesses. So how do we understand the relationship between inflammation and the mental illness, and what evidence do we have that inflammation can cause depression or cause other mental illnesses?
There's a couple important points. One, there are many paths to inflammation, right? So it could be an infection, a tick-borne illness like Lyme. It could be stress, chronic stress. It could be post-traumatic stress disorder. It could be obesity. It could be ultra-processed foods. There are many paths to inflammation in the body and neuroinflammation. The most substantial research that I've been exposed to is that path of inflammation affecting suicide risk. And it's quite dramatic and I think ignored by our community, medical community. So, another common path to inflammation is sleep deprivation and then traumatic brain injury. And these all elevate suicide risk. So if we make a list, elevated inflammatory markers increase suicide risk, traumatic brain injury, increased suicide risk, sleep deprivation, increased suicide risk, vitamin D deficiency increases suicide risk via increasing inflammation. We know vitamin D controls that. So the list is long, and there's growing research on inflammation and depression. I think that in my experience, not every patient with depressed has inflammation. Some do and some don't. But you have to understand what that individual is struggling with. And sometimes it's really simple to look at the root cause.
Okay, so how can someone knows that he has inflammation, and does the regular markers that we test, for example, are I know that they are the CRB and the ESR. These are the regular lab tests that are done to test for inflammation. But do these correspond with neuroinflammation? So if I have like inflammation in my body, does this mean that I have inflammation also in my brain? How do we test or know that we actually have inflammation?
I mean, it's challenging. I mean, I think some of the studies were done looking at, as you said, C-reactive protein, which is a simple, inexpensive lab test, and high elevated levels associated with, increased rates of depression. In terms of neuroinflammation, the only marker that I know of that's accurate is called quinolinic acid. So we can detect this metabolite of tryptophan metabolism, which is a kind of neuroinflammatory marker in the urine. So quinolinic acid, it's not common that you see it, but when I see it, it reflects neuroinflammation and often challenging patients to treat.
Okay, so what are some of the most famous supplements that someone can start taking to lower his inflammation? For example, we know that like if we will develop like a plan or a program to help a patient lower his inflammation in his body, what will we use with him, or what our treatment plan will be with such a patient? What are top 5 things that are powerful anti-inflammatory that we know of?
Sure. I mean, I think again with inflammation, we want to understand the cause. So we want to treat the cause. It could be a Lyme disorder, or it could be a vitamin D deficiency. But some of the common anti-inflammatory things. One is the diet, cleaning up the diet. Zinc is usually deficient. So zinc, magnesium, the omega-3s, and then one of my the 2 favorites that I've used for many, many years, anti-inflammatory supplements are nutritional lithium and the polyphenols, the OPCs, the oligomeric proanthocyanidins. So the grapeseed, pine bark, green tea, curcumin, that combination is incredibly helpful for brain health and inflammation.
Yeah, since you mentioned lithium, you seem to be very interested in using nutritional lithium in your practice. So, if anyone hears about lithium, he will hear about it in the context of bipolar disorder, lithium carbonate, and we will talk about monitoring the thyroid and monitoring the kidney function on it. But what is nutritional lithium, and what is its role in mental health, and why do you believe everyone should be taking that trace mineral?
Yeah, lithium is probably the most important nutritional supplement I've used in my practice over many years. We think of lithium in 3 different buckets. One is an element that we use in our computers, in our airplanes, and our cell phones, and lithium batteries everyone's heard of. And then lithium carbonate is a medication, right? We use for bipolar disorder. There are significant side effects, and that's why compliance is a problem. My work has been with lithium orotate, a micronutrient, a supplement that we use for many, many problems, typically with symptoms of irritability, impulsivity, aggression, and moodiness. And nutritional lithium, we use it at low dosages, 2 to 5 milligrams, and it's, again, one of the most helpful supplements in my practice. I could go on for hours, but just one quick, research study that came out last year on looking at this micronutrient for the prevention of Alzheimer's. So that's what I've been kind of writing and talking about for many years, but a kind of landmark study came out of Harvard looking at a mice model of Alzheimer's. So they developed plaques and tangles very early on. So we can see that in the brain. And they gave the mice lithium orotate, this nutritional supplement. And it actually, if they gave it early, it prevented the dementia and Alzheimer's pathology. And then if they gave it later on, when the mice developed it, it actually reversed the
Wow.
plaques and tangles of Alzheimer's. And they actually didn't believe it, so they had to keep repeating it to demonstrate that this was accurate. And other forms of lithium carbonate, didn't do that. So that's why I think it's really important that everyone understands lithium orotate.
What is the difference between lithium carbonate and the lithium orotate? Aren't both of them are giving nutritional lithium anyway?
They're both giving the elemental lithium, but the carrier molecule makes it you need more carbonate, so you tend to have many more side effects. So lithium orotate tends to cross membranes easier, and you need lower doses to be effective.
Okay. And how is it working in the brain? What is the mechanism of it?
Well,
Walk us through that.
the list is endless. It's kind of if you start looking at the research, there's just hundreds. But the big ones are, we know lithium is anti-inflammatory and it's a powerful antioxidant in the brain. We also know lithium increases the calming neurotransmitters, GABA and serotonin, and decreases the kind of excitatory glutamate and dopamine. So it kind of shifts the brain to more inhibitory controls. And then there are hundreds of other kind of second messenger and epigenetic changes that lithium appears to, be critical for, for brain function. For any technical listeners in your audience, it appears that the most consistent and might be the main mechanism is inhibiting an enzyme called GSK3. And that contributes to inflammation in the brain. So if we had a molecule that inhibits GSK3, we decrease inflammation. And that is probably, the kind of umbrella mechanism that most people discuss as to the role of lithium in the brain.
If I want to say a statement and to know how much do you agree or disagree with such a statement, can we say that medications don't heal and the body heals itself? It's the body that is dealing the healing, and we as doctors, what we eventually are doing are just helping the body to simply giving it the right environment to heal, but medications don't heal by themselves. How much do you agree or disagree with such a statement?
Yeah, I think at this point, I would agree with that, maybe 75%, because what we're seeing is individuals with significant genetic vulnerabilities. Genetic vulnerabilities, like you don't produce, or I mentioned the genetics of vitamin D. You have these genes where you need very high levels, and you can't get that from food. You need to take supplements. So when I factor in these genetic vulnerabilities or celiac or other kind of disorders or folate metabolism, MTHFR, so I believe that we can overcome these genetic vulnerabilities by testing, and then those individuals would benefit from supplements. So they might not, as much as they have tried, to heal their body through diet and exercise and taking care of themselves. So I believe there's a subset of those struggling with mental illness who would benefit from interventions that we've discussed.
Mm-hmm. One of the most important topics that many people search for right now, and the cause of taking a lot of supplements online, is the topic of brain fog. Okay, especially people who are high performers and people who are trying to improve their cognition. So how do we understand this phenomenon of brain fog, and how do you regularly deal with someone who comes to you and says that he has brain fog and he tried a lot of things, but it didn't work with him?
Yeah, I mean, I'm really concerned actually about people just buying supplements, either at the drugstore or the supermarket or online, because one, there's no regulation in the industry, right? There's nobody monitoring if that bottle that says 10 milligrams actually has 10 milligrams. And there are a number of studies that have been done, just picking 10 of the same supplements off the shelf, 10 different companies, and they all say 100 milligrams on the bottle, but some might have 10 milligrams, some might have 200. So it is an unregulated industry, number one. And number two, there are interactions with supplements and with medications, and they're not just kind of benign. Just because you think they're natural, they're not. So that's why, I think taking a multivitamin or magnesium or fish oil, would be okay. But to take these massive amounts of supplements without understanding your genetics or without doing the testing, I think has potential side effects, and we've seen them.
Okay, so about the topic of brain fog, how should we think about it, about treating it, and what some of the root causes of it do you regularly do with your patients?
Well, again, we've seen brain fog with mold toxicity, and we see brain fog with B12 deficiency. So it really just comes down to the underlying cause. The most common things that I use are the OPCs, the polyphenols, because that really supports attention and focus. And then sometimes an herb called rhodiola can also support attention and focus.
Okay, so this should bring us to the topic of ADHD, which is on the rise these days. Tell us more about how do you treat this disease, and what are some of the common root causes do you see in your patients?
Sure. ADHD was the first book I wrote, and the second edition's coming out in a couple weeks. So the research is substantial, but often ignored. And again, too many parents are just taking supplements without knowing what's going on. But the most common deficiency that we've seen for ADHD children and adults is magnesium deficiency. So magnesium is the number one supplement we recommend for ADHD. And then after that, zinc is common, and we have studies going back 30 years on zinc deficiency and ADHD. The zinc helped the medications work better, and zinc improved ADHD symptoms without any medication. So that research has been long-standing. So magnesium and zinc. And then, if someone for ADHD, we think of, impulsive children or impulsive adolescents, and those individuals respond best to lithium, the low-dose lithium orotate that we've discussed.
Mm-hmm. If a lot of people are taking supplements these days, there are on the left side of the equation, like there are some people who are saying that we don't need to take supplements, that food is just enough. If you eat a lot of vegetables and a lot of fruits, you don't have to take any supplements. So how would you respond to those people?
Yeah, I think that I agree that if someone ate a whole food, nutrient-dense diet, that supplements are probably not needed. We do want to test first, again, looking at those genetic or autoimmune problems. There could be, reasons like the B12 I mentioned. You can have something called pernicious anemia, where you have antibodies and you need B12 and you need vitamin D. So I believe you can get most of your micronutrients from food, but you need to make sure that you don't have another cause for some of these very significant nutrient deficiencies that affect brain health.
Mm-hmm. But one might argue that this can be true like 200 years ago. Oh, yes, this could be true, but in our modern era and in our modern agriculture, the soil doesn't have anymore the elements in it. So our vegetables and the fruits don't contain the nutrients that they used to have. Is this correct, or are we making it look more pessimistic than it should be?
I haven't looked at the research in a while, but for years, I had slides demonstrating, the amount of micronutrients, that are coming out in our vegetables are lower. Magnesium is completely, not put back in the soil. So magnesium is very deficient in our soils. So absolutely, there's evidence that the food we're eating is not as nutrient dense. And there's also the glyphosate and the pesticides that probably interfere with nutrient absorption, zinc in particular. So there are many paths. I'm certainly a fan of nutritional supplements, and I both recommend them. My only caution is people just taking a bag full of supplements without knowing what they're doing.
Yes, exactly. To wrap up our conversation, what message would you like to leave with our audience across the Arab world, both patients who may be struggling with mental illness and also clinicians who are trying to help them?
Yeah, well, I think, well, number one, one of my books have been translated into Arabic, a book on anorexia nervosa. And I think it's important, most important work for me because anorexia, eating disorders, have the highest mortality of any psychiatric illness. And again, it's been a path of keeping me in this field, looking at nutrition and brain function. You know, malnutrition in our patients with eating disorders, depression, anxiety, and higher suicide risk. The most important part of everything we talked about, which I think is challenging for clinicians, frustrating for patients, but the only path to getting better for some is this concept of everyone's different, biochemical individuality. And by doing some basic testing, we talked about 5 critical ones, maybe we could do 6 or 10, but whatever testing we can do, we can begin to understand if there's something that is both treatable and can give patients a more solid foundation. So then you can still use all your other tools, whether it's a ketogenic diet, medication therapy, or all the above, but filling in these nutritional deficiencies, I think is step one and foundation for recovery and complete remission from many major psychiatric illnesses.
Thank you very much, Dr. James, for this conversation and bringing the science to our audience in the Arabic region. Finally, how can people know more about your work and find you online?
Sure, that my website is jamesgreenblattmd.com, and we'll be starting in September. I'll be starting a series of free webinars. So the first one is going to be on lithium, as we discussed, and I'll be offering twice a month free webinars on this material so people can have more access to how to help and improve mental health outcomes.
Great. Thank you very much for being with us and give us your precious time.
My pleasure. Nice talking to you. Take care.
Thank you very much.